next speaker. So we have here a case of steroid-induced glaucoma and carpet in a case of juvenile allergy. Dr. Abhishek Sharma, please. Maybe the next speaker can be ready so that we, Dr. Risha Kumari is there. Yeah, so be ready with the moment the discussion starts to be there so that we don't waste time in the transfer.
A very warm morning to one and all present here. Today I will be showing all those cases that we have encountered when we organized the camps in the remote areas of Himachal Pradesh, 200 kilometers from the tertiary center. So beginning with the first case. So it's a 17-year-old male who presented in the camp to us with chief complaint of diminution of vision in both of his eyes. And there was no any ocular complaint from his side, and examination was also normal as far as systemic examination was concerned. So he's a educated patient. He was a student of class 10th, and what he revealed was quite astonishing for us. What he revealed is that he was using certain sort of drops for the last 4 years, and when we procured the drops from him, it was a combination of ciprofloxacin and dexamethasone eye drops, and he has used over 50 vials of these drops in the 4-year duration, and because of which what we observed is that he is having a significant glaucomatous cupping in both of his eyes with a significant RNFL thinning, and optic cup to disc ratio in both of his eyes was 0.8:1 in the right and in the left eye it was 0.9:1. Relative afferent pupillary defect was present in the left eye, and posterior subcapsular cataract was present in both of his eyes. He was a reluctant patient. They were not willing to come to the hospital because of his family members. Actually, the mother was not willing to take him to the hospital. Vision was 5/60 and 2/60 in right eye and left eye respectively. So we brought him to the hospital with our own expenses, and the steroids were stopped. And he was given anti-glaucoma medication at the hospital, and we reviewed him after 2 weeks. The pressure was 20 mmHg in the right and left is 24. So on the follow-up, we planned for surgical combined extraction with a trabeculectomy, and on the subsequent follow-up, the right eye pressure was 12 mmHg and left eye was 14, and his vision was 6/24. But right now his right eye vision is finger counting. Another case, a 15-year-old male who is a daily wage worker, also hailing from Himachal Pradesh. He also came with the chief complaint of diminution of vision, and what he told was he has been using topical drops since his childhood without any visit to an ophthalmologist. This was the status of his disc in both of his eyes, in the right and the left eye. The optic cup to disc ratio in the right eye was 0.9, both is 0.9. This is the OCT image of this patient, where you can see a significant deep cupping with a significant RNFL loss in both of his eyes. Pressure in the right eye is 40 mmHg, left eye was 34 mmHg, and we planned for a trabeculectomy surgery for this patient. And after the trab surgery, the right eye pressure was 16, and in the left eye it is 14 mmHg. Vision in the right eye was 5/60 and left eye 6/36. Later he was diagnosed with amblyopia in right eye. I have not come here to highlight what the steroid cause, because it's an age-known fact that the side effect of the steroids is glaucoma and cataract. What I want to highlight is that the source of steroids, lack of awareness, absence of medical supervision. All of these patients have procured their steroids eye drops from the local practitioners or the medical stores, and they have been using this for extended period of time without even consulting any ophthalmologist, without seeking any review for any IOP measurement. None of the patient is knowing the potential side effect of these drugs. Absence of medical supervision, most of these patients rely on the local pharmacist or a general practitioner available over the sub-center or the primary health center over there. And these people who are available there, they are not well expertise in managing ocular allergies. They just dispense the steroids over the counter and unjudiciously, and also these patients are using these steroid eye drops unjudiciously for the extended period of time, and here we are. This is an avoidable cause of blindness, and the first patient that I've shown you, his vision in the right eye right now is finger counting at 1 meter. Now, who is responsible for this? Regulatory bodies, general practitioner, pharmacist, ophthalmology, and eye care professional, patient, and the public. Regulatory bodies, I would request for the stringent regulation to be made for the dispensing of these drugs, although these falls under the category of Schedule S drugs, but still they are dispensed over the counter. General practitioner, pharmacists, there must be educational programs for enhancing the knowledge of the general practitioner while dispensing corticosteroids. And we have initiated this in our center, and we are organizing a 15 days posting in every department so that basic medication they can dispense, and they must be knowing the side effect of these. Patient and the public, as an ophthalmologist, we must advocate for the judicious dispensing of these drugs. Thank you. This is all from my side.
So very important point highlighted. We're all been banging our heads against it. So I'll just, before commenting, I'll just take a quick head check. Rishu Kumari is there. Just be on the dais. Prasanna is there. Nimrita is there. Okay, Nimrita has come. Preeti Tripathi is not there. Tiruvedi Sai Vishwanath. Tiruvedi Sai Yashwant, not there. Not there till now. Poonam, not there. Asmita Gope, okay. Rajiv, Virgis is there. Okay, great. Come in the front, Richard. Anuja Patil, not there. Pankuri, okay. All the speakers, please come on the first two rows. Durga, okay, wonderful. And Kirti, no. So then we can, accordingly, we know how much time to give because we must finish by 11 o'clock. So my take on this, whether each of us can give one comment each. So a very important topic you've highlighted. Sir, there is a regulatory body which prescribes, it says, but it is not being implemented. And there was a very interesting study from Chitrakoot, a very large study on BKC children being given the steroids. And mind you, they were prescribed 80% by doctors, by qualified doctors, not the quacks or the chemists. So we need to regulate ourselves whenever we prescribe steroids or whenever we see this. We educate the families and we tell the patients, especially BKC, that this medicine can cause problems. Do not use it over the time. Use it only for 2 weeks or 2 months and write it on. What I do is write the mother's or the father's name on the OPD card. Let's say you, Abhishek, your son has this. आप ये दवाई 2 हफ्ते के बाद नहीं डालेंगे. You will come and check. Otherwise, it can, and you make them sign. It's a very small thing I'm telling you. You make the parents accountable. That's for children. For adults, you just have to tell them that's what about blindness, but it's already too late. So to prevent it, we have to be accountable, and that's exactly what I was saying, antibiotic steroids we are giving as a drop of a hat. Last epidemic in 2023, I don't know how many of you saw Moxie-Dexa combinations being used, right? What was the rationale for a viral epidemic in antibiotics? So we need to relook at ourselves. Last was VKC. Does this child have VKC?
Yes, ma'am. Both of them.
You gave brimonidine to the child and prostaglandin. For a steroid responsive glaucoma, that would not be my first line. Over to you.
Absolutely agree. We all have to take initiative on stopping this steroid use. Every prescription that you write steroids, even for post-op, you have to give the instruction when to stop in writing. Okay, otherwise we are liable. There's no less this thing. Having said that, I really want to re-emphasize what Dr. Kirti said, that the antibiotic use. Actually, in Karnataka government now there is a policy that you cannot give even oral antibiotics unless you have proved that there is it is a bacterial fever. So first 4 days of 1 week, the physicians also do not give antibiotics to prevent antibiotic abuse. So we are also liable if we are giving antibiotics just like that.
Well presented. So we published way back in 2013 that I come from a tertiary care center from North India. So what we see is we see 4 VKC children with steroid-induced glaucoma who undergo surgery every month in our center. And we had published that 1/3 of them are unilaterally blind when they come to us. And we all would be surprised that maximum people who are actually, prescribing these medications are not physicians or general practitioners, they're ophthalmologists who are not checking fundus, who are not checking the IOPs. So it is us who are to blame for this menace, and it is never ending. It is not ending. We also tried to, to bring about some change. We published in the newspapers to create awareness, but this still needs to be tackled with, at the
You are a
front.
GSI member. Let's have the next slogan, Stop Steroids, SS. Next GSI campaign of the glaucoma week should be Stop Steroids.
Stop steroids.
We can have some catching things.
I know.
Let's join hands.
Something needs to be done. So I also take this opportunity